Welcome to my presentation titled, I am not HIV-AIDS. I am not my diagnosis. So what will I actualize? Every time I say I'm talking about people living with HIV, in particular adolescents and young people. To actualize means to understand from one's own views and experiences. And you will actualize and reflect on what your HIV diagnosis means to you and why you are not HIV-AIDS. Now, throughout the slides, during this brief presentation, you're going to see this thought bubble, which appears on the slides. And that is your thought process with respect to HIV-AIDS. And you're going to see this thought bubble coming up in every slide. Now, there is a researcher by the name of Jeffrey Arnett, and he's termed the coined emerging adulthood. Now, you need to understand that young people, and adolescents included, go through many different domains throughout life. As early as the age of insight, being aware and logic about our surroundings and our community comes up. And this is usually at the age of 6 to 7, depending on cultures, beliefs, and education background. From that time onwards, young people are usually asked questions such as, what do you want to be when you grow up? And that is something that we all need to understand concerning HIV/AIDS as well. Young people are many things. They often ask themselves, who am I? Am I going to fit in? Am I going to like so-and-so person or so-and-so? Am I really an adult? Young people go through concepts such as identity exploration as early as the ages of 8, going as far as late 20s. Instability, not realizing the uncertainty around their well-being and their physical health as well. Self-focus, trying to figure out this is what I want to be, but then at the same time, having certain expectations towards their relationships, towards their surroundings, towards what they want to do. Possibilities, and this applies to both the low socioeconomic as well as the haves. The individuals that may have privileges, they still go through concepts of uncertainty when it comes to possibilities. Feeling in between, well, I'm not quite old yet, but at the same time, I'm still young. But then why are all these expectations coming towards me? And of course, relationships, friends, family, sexual identity, as well as social media now. All of this makes up a young person. Now, this is where the concept comes in, emerging adulthood. Another thing that young people want to understand and usually ask, and this is something that has been very common in my grassroots outreaches, is why do I think like this? And why is it that I'm thinking about HIV? A concept known as metacognition, thinking about thinking. And when young people are diagnosed with HIV/AIDS, or young person with living with HIV/AIDS, the thought of HIV/AIDS overpowers all or majority of the thought processes. And because of how society perceives HIV/AIDS, the thought processes in that young person is always negative, majority of the times. And this is where what others think of me is their choice, but what I think of myself is my choice is diluted. Many young people start realizing that HIV/AIDS is bad, so that means I am bad. And this is something that people living with HIV, young people living with HIV need to come to realize, that I am what I think, and HIV is not all of me. I am what I do. Continuing from what I think, because of all the feelings of what HIV/AIDS brings in the young person's life, that leads to certain behaviors. Now, this is an anecdotal slide where you see an iceberg. Now, many people often just get to see the surface of the iceberg, which is at the top. And many people will see young people behaving and portraying anger, having challenges with their sleep, avoiding, or having negativity. And these are just the tips that we see as healthcare workers in our practice. We see these behaviors. As carers of young people living with HIV, this is what we see. But oftentimes, we don't see what is underneath, below the surface. And these are the feelings of being ashamed, feeling overwhelmed, feeling helpless because of HIV/AIDS. And this is a common theme, again, that has come out from the many years of my grassroots outreaches. I have had young people ask me to say, because there's that billboard that says HIV/AIDS kills, does that mean that I am going to die? Does that mean that I am the person that's wrong? These are the things that people need to come to realize, especially as researchers, as healthcare professionals, as NGOs that offer support to young people living with HIV. I am what I see. Young people see and learn from the surroundings. And they often start comparing how they feel inside to how others appear outside. And this is an anthem that we should promote as we support adolescents. Don't compare how you feel inside to how others appear outside. Young people need to realize that as an individual, they live in a group, in an organization, in an environment, but that doesn't mean that what everyone portrays about HIV is what they are. They are not HIV/AIDS. Many outreaches that happen with respect to HIV awareness and also promoting prevention are directed at people not living with HIV. Hashtag AIDS kills, hashtag know your status. All of this is directed at people not living with HIV. And it takes away and it puts a side effect or a complication to people living with HIV. Because every time a young person sees that billboard, that young person feels threatened because the young person feels that's my identity. And this is what young people need to be supported through, that don't compare how you feel inside to how others appear outside. A big, big theme that has come up is end the stigma. Don't push your biases towards HIV on people living with HIV, but rather understand what HIV is and fight HIV itself. Then the question is, why is it that young people or many people living with HIV have to identify as I am HIV positive? Why is it that advocates have to do that? Because of the previous things that I've shared, emerging adulthood with the many domains, what I see, what I behave, what I perceive in my surroundings, many young people take it upon themselves and they stigmatize against themselves. And this is where I tell all young people living with HIV to say, end the self-stigma. You are not your diagnosis. Your thought processes should not just revolve around your HIV/AIDS. How do you do that? Unhook yourself from your HIV/AIDS. A hook is a metaphor, a concept, such as fishing. When a fish gets hooked, it cannot get away. And this is what HIV/AIDS does. When something is on a hook, it cannot get away. The hook traps it. In the same way, we can get hooked by our difficult thoughts and feelings. And because of that, an emotional storm appears around HIV/AIDS. An emotional storm means that you experience intensely difficult thoughts and feelings. They are so strong, they are like a mighty storm and they can easily overpower you. And this is what the inherent identity of saying, I am HIV brings. It just hooks you and it takes away from everything else that you are. Another concept that professionals and individuals in the space of HIV need to promote is circles of concerns and control. At the background, you see that there's that thought bubble of HIV. What I think, what I do, what I see towards HIV. But young people need to be empowered and supported to understand that they need to know what is in their control and what is outside their control. What people think about HIV or the billboards that share preventive messages about HIV is not directed at them. That is outside their control. But what is in their control is realizing that there are more than HIV. What is in their control about the HIV diagnosis is taking their medication, getting to communicate about how they feel, getting to realize their potential towards their identity, which is more than HIV. Self-care and boundaries. For adolescents and young adults as old as 29, 30, you need to incorporate self-care and boundaries in treatment. Making them realize and actualize that their goal is not to be better than anyone else, but better than they used to be. Asking themselves, how are they? Do they do things for themselves when it comes to their mood, their well-being, their sleep, and their food? These are deliberate things that young people need to invest in. And as healthcare workers, as researchers, we need to promote this narrative in young people. Self-care is any activity that we do deliberately in order to take care of our mental, emotional, and physical health. Trigger warning, not wanting to leave. And this is something that many people, young people, including carers and healthcare workers, shy away from. But this is a very common concept in emerging adulthood. Not wanting to leave, self-harm. Everything, identity exploration, instability, self-focus, relationships, life expectations, these can trigger thoughts of not wanting to leave. That doesn't mean that the person does not want to leave. Because of the HIV/AIDS, all these things get masked up. It's not all visible because HIV/AIDS takes the front seat. And because of that, young people have thoughts of not wanting to leave, to distract from emotional pain, to release tension, to feel something, to express self or self-punish. And as individuals in this field, we need to be aware of this and address it. Have open spaces, not to sensationalize not wanting to leave or suicide, but rather having open spaces to communicate and giving young people that identity to communicate all these concerns that they have. Making young people realize that health is a complete state of physical, mental, and social well-being. HIV/AIDS is more than antiretroviral treatment. It is the key, it is important, but that is just the biology. What about the psychological as well as the social contact and support? This is inherent in well-being. And this is where concepts such as talk therapy and psychotherapy need to be promoted side by side in adolescents and young people's treatment. Making them realize that brain health works with therapy. It creates new pathways in their brain. It helps them feel better about themselves. It helps promote language and describing how they feel. And it's directly correlated to brain health and well-being. Young people need to be helped to make them realize that there are a lot of things that they are in their control. I am not what happens to me. I am what I choose to become. Basic outpatient or inpatient support strategies such as deep muscle relaxation or breathing exercises that take as little as 5 to 7 minutes need to be supported in treatment of young people living with HIV/AIDS. And this should be prescribed as they go home so that they can be aware of their own well-being. And this helps with their treatment when it comes to HIV and AIDS. With that said, for every young person from my grassroots outreaches, I have come to realize that they need to understand that I am not HIV. I am me. And every young person living with HIV, I would like to tell you to say this to yourself. I have HIV/AIDS. I am not HIV/AIDS. I am not my diagnosis. My diagnosis is a part of me. I have HIV/AIDS, which is but a part of me that does not define who I am. And self-stigma towards yourself. And homework to everyone. Allow yourself to be proud of yourself and all the progress you have made, especially the progress that no one else has seen. I would like to dedicate this presentation to all the people with lived experience who have over the years welcomed and allowed me to share their reality and offer my support. The best advocates are people with lived experience. Thank you.